What's up, ladies and gents? Social Nurse here with another video. I'm going to talk about Dr. Umar Johnson, Hope Giselle. What I'm going to talk about is if Hope Giselle should have disclosed being a transgender woman. I'm also going to talk about Dr. Umar believing that it was necessary. I'm going to touch on licensure. There's questions about if Dr. Umar is a psychologist or a doctor of psychology. Let's talk about it really quickly. I do not think that it was necessary for Hope Giselle to disclose being transgender. The Tammy Mack show had several panelists there. They invite these people on the show. I think that it would be a good idea to ask the producers or whomever organizes the show who's going to be on the show, right? Then research who's going to be on the show. That way you can know who you're dealing with. It might affect your strategy in the conversation that you're having. So maybe Dr. Umar would not have referred to Hope Giselle as a beautiful queen if Dr. Umar knew that Hope Giselle is a transgender woman. My understanding is Hope Giselle is transsexual, has actually had the work done, right? That she is now presenting as a she, not only from what we see, but has surgically had penile inversion, right? Breast augmentation or surgical enhancement, as well as a period of time of therapeutic hormone medication to help present as woman, right? And Dr. Umar should remain professional during any debate and maybe not use sweet nothings at all when addressing the people in the conversation. I do believe there is a time for transgenders to disclose, but I think that is with intimate partners, just not to the general public running around exclaiming that you were born a male and presenting as woman now. I think when it deals with intimate partners, people that they're sexually involved with, relationships, someone that they are a pair, they are possibly going to get married. Whatever the situation is, I do think it's necessary to disclose because someone could end up being put into the ground via expiration, right? People get hurt when they feel that they have been tricked or deceived, right? Because a person might make a different decision. They just may not want to be with someone who is biologically the same thing that they are, regardless of how the person presents, right? Licensure. People want to know if Dr. Umar is really a doctor. I don't think he's a medical doctor at all. When we think of medical doctors, right, we think of doctors that have gone through an educational system, have successfully completed that educational system, have passed the necessary tests, and are licensed in their field of practice as a doctor. We think of our primary care physicians, our medical doctors, our doctors of osteopathic medicine, which also practice holistically and can prescribe and diagnose, and our doctors, right? We think of our dentists, our chiropractors, right? When I think of a doctor that's a PhD, a doctor in a philosophy, I think of what comes to mind is my college instructors, right? We're talking about Dr. Umar, so I will use my psychology instructor in college as an example. My psychology instructor had a PhD and was advanced level degree in studies and completion of education in the field of psychology. My college instructor had a PhD in psychology, right? And had licensure, was a practicing psychologist, right? Right? Do you get what I'm saying? Dr. Umar might be claiming to be a psychologist, but is he even a licensed psychologist? Has he gone through the different levels of education? Is he a PhD? When someone, again, I will use college instructors, a lot of them are called doctor this or doctor that, whatever their last name is. That's because they have an advanced degree, a doctorate level degree, a PhD level degree in their field of study, topic, subject matter. Dr. Umar's case, we're talking about psychology. So if Dr. Umar has an associate's degree in psychology, can't go around saying he's a psychologist. If he has a bachelor's of science degree, or whatever it is, liberal art, whatever the psychology degree is as far as bachelor levels, can't go around saying, oh, I'm a psychologist, right? He could go around saying it, but it wouldn't be true, because we understand that a psychologist that practices needs a certain licensure and education in order to really be called that in a truthful way, right? This doesn't only apply to psychology. This can apply to nursing. If you're a nursing assistant, you shouldn't be saying you're a nurse, right? If you're an associate's degree in nursing, you're not the same level of education as a Bachelor of Science degree in nursing. If you're a licensed practical nurse, you're not a registered nurse. If you are a Bachelor's of Science in nursing degree, you're not a nurse practitioner. If you don't have a master's degree level in nursing, then you shouldn't be claiming master's degree if you're a BSN or ASN or LPN or LVN. The occupations we work in, many of them have different levels of degrees, education, and licensure. So if Dr. Umar is claiming to be a psychologist and a doctor and he's not, that's just not good practice, right? I don't even know if he's a counselor or a therapist. To be a counselor or a therapist in a certain subject matter or field or behavior, or a social worker, you need certain education, training, certifications, and licensure to even counsel and offer therapeutic conversation to people, right, in assessing people properly, right? So Dr. Umar, we don't know if you really are a licensed psychologist, right? We've not seen the school yet in an operating mode. So people, we've got questions. Thanks for stopping by the channel, Social Nurse.